Hey everyone, it's Jennifer Breaker. This week I decided to do a brochure on lymphedema. Lymphedema is a lymphatic condition defined by low flow edema that occurs when lymph transport capacity is inadequate to transport the normal volume of lymph. In figure 1, I added this for it to be patient friendly. You can see that there's a disruption of flow within the lymphatic ducts, and that's the blockage is what leads to the fluid retention, causing the lymphedema to occur. There's two types of lymphedema. There's primary and secondary. Primary has no known cause, so it's idiopathic, and secondary is caused by damage to the lymphatic vessels or nodes. Moving on to pathogenesis, fluid volume is normal, but the transport capacity is impaired because of disruption of flow. Additionally, fluid volume may be increased, and the transport capacity is impaired because of some form of blockage. Moving on to clinical signs and symptoms, there's early and late symptoms. Early symptoms include numbness, burning, aching pain, feeling of skin tightness and limb heaviness, and that's why I added that. Jewelry such as rings and watches and bracelets may feel really tight. There's also the sensation of a decreased range of motion, and you have difficulty making a fist. I also included stages of lymphedema and what characterizes each one. Stage 1 is characterized by pitting edema, and that's when if you press into your skin and you remove it, there's still an indentation from where you pressed, and that can be seen in figure 2. Stage 2 is when fibrosis occurs, and stage 3 is when starts to become changes in the skin, such as keratosis, which is a thick callus forming, and papillomas, which is a form of blistering. And then moving on to medical management, the most important thing is prevention and education. We want to educate everyone on those signs and symptoms and know that we need to help them prevent lymphedema because it's a lifelong chronic condition. As for medical management of people with lymphedema, surgical procedures can be done, but they're not curative, and medications have not been shown to be effective, and NSAIDs could make the condition worse. I forgot to mention that the later signs and symptoms include increased limb girth and is also characterized by skin changes and hair loss. To diagnose lymphedema, you'll have to go through a clinical diagnosis. MRI and CT scans are used in patients with a history of cancer to rule out reoccurrence. In figure 5, this lady had a history of cancer and chemotherapy, and as you can see in the photo, she has lymphedema on her left arm. And you can also see that there's also weakness present in her left arm compared to her right. She cannot elevate it as high. She was diagnosed with a recurrence of her cancer and must undergo lymphedema treatment. Venous Doppler studies are used to rule out blood clots, and Stemmer's sign is presented in figure 3, and there's a thickening of the skin flap on the toes visible. Physical therapy is important for prevention and education. We want to prevent lymphedema from occurring. But if a patient does develop lymphedema, we want to reduce swelling and control pain caused by the condition. Interventions would include massage, compression bandaging, and garments, as well as light exercises. In figure 4, you can see a patient has compression wrapping to the affected limb. And I included that physical therapy can be helpful because people with lymphedema may experience neurological and musculoskeletal changes that can alter their balance, walking, range of motions, and cause muscle weakness. These can be addressed in physical therapy. Specifically, if you think about an older patient who is already at greater risk for falls and they develop lymphedema, they have these changes, and then if they have their altered balance and walking, then they may fall and they could fracture their hip. So we want to do what we can to help prevent any more injuries from occurring. And for summary, if you are at risk for developing lymphedema, be aware of all the signs and symptoms. Always communicate with your healthcare team about any symptoms you may experience, including swelling, anything that's minor. Just communicate with your team so we can help prevent the condition, and prevention and early diagnosis are essential for the condition. I included all my references that I got my photos and my information from. Thank you.